When the administration came in, they literally co-opted the U.S. digital services and fired a lot of people. And they're like, this is now called DOGE. That is when I personally began to feel the effects of DOGE sort of being in my life as a Fed. I work for a operational division under Health and Human Services that administers Healthcare.gov. We make sure that each plan that is sold on Healthcare.gov meets our thresholds that were established in the Affordable Care Act. There are no junk plans. There are standards in place for the plans that are sold on this exchange. Things that I think a lot of people like, such as allowing your dependents to be on your plan until they are 26 years old, not allowing insurance companies to deny you coverage because of a pre-existing condition. Those sort of protections that I think Americans are accustomed to, but really could be taken away at any moment. I work with a group whose job is to eliminate fraud, waste, and abuse, particularly around companies in the marketplace who may be fraudulently enrolling consumers or selling plans that aren't really plans. And we lost a third of our staff and won't be able to hire anymore. If we really wanted to be rooting out fraud, waste, and abuse, I would not be cutting the staff of divisions whose sole job is to eliminate fraud, waste, and abuse. We lost, in my department, about 200 probationary employees. Most of them were really young folks just getting their start in their government careers. Many of them were in the Presidential Management Fellow Program, which was designed to bring private sector talent into the government. It has since been eliminated. I remember when the executive order for DEI first came through, and then came the requests for the scrubbing. We were instructed to scrub the words minority, minority-owned, diversity, gender-affirming care, trans, bisexual from the Healthcare.gov website. The list was very long. My favorite one was woman and woman-owned. I really just couldn't believe that this was happening. I'm like, what do you mean we can't say women? I have girls too, and do I want to try to explain to them that America doesn't identify the unique concerns and health needs of women? That has also been incredibly disheartening. People think that feds just kind of like clock in, clock out. We literally stood up an entire insurance marketplace from scratch with just like grit and determination. People in the private sector, if they did a startup with this, they would all be multimillionaires by now. And I can tell you that none of us are living in that manner. I could work for a health insurance company. I could work for a tech company. Like, I really have skills that could make me a ton more money in the private sector. But it's just not who I am. I am a public servant.